All right. So, hi, everybody. Thanks for being here today. My name is Therese, and I'm an Information Services Librarian at Lawrence Public Library. This is our second to last Civic Engagement 101 event. The series is held in partnership with the League of Women Voters of Lawrence Douglas County and co-sponsored by Kansas Public Radio. This event is being recorded and will be uploaded to the library's YouTube page within a few days. I'm very grateful to our esteemed panelists for being here today and sharing their expertise and experience relating to reproductive rights so that we can all be better informed citizens. I do want to acknowledge that this is a very personal and emotional subject for many of us. Our goal of this event is to provide information from knowledgeable speakers on the issue. It is not to tell anyone how to vote or what to do with their bodies. We have 5 questions to cover, and each panelist will have about 3 minutes to respond. We're trying to keep the format casual and allow for conversation, but we also want to be sure that we share time and cover all the points. We'll save the last 15 minutes for a Q&A, so if you have questions at the end, you can type it into the Q&A box. So with that, let's go ahead and get started. A huge thank you to our panelists. I know you all have multiple titles and roles in our community, but let's start with each of you sharing your name and a bit about your related experience on this issue. And I don't know, Amber, do you want to go ahead and get started?
I was going to say, since I'm off mute, I'll go ahead and go first. So good evening, everyone. My name is Amber Sellers. I use she, her pronouns. Lived in Lawrence for about 11, going on 12 years now. I'm a homegrown Kansas native and done work around health policy, public health, and public health advocacy in the state. I think it's just been my life. So started with early care and education with children and youth, progressed into more healthcare across the lifespan. And as of lately have done work around reproductive health, reproductive freedom, reproductive rights, the whole ecosystem of reproductive health, including birth equity as well. And so this past few years, I've been doing more government affairs work centered around access and just expanding one's educational horizons around what reproductive freedom truly is and what it could look like in our state. I'm going to popcorn to Pegah.
Hi, everyone. I'm Pegah Naemi Jimenez, she, her pronouns. You know, today I'm showing up as a birth doula. So I support births from pre-conception to when a baby is delivered, I guess, and also postpartum as my clients need it. You might recognize my name as an academic researcher as well, but today I show up as a birth doula and my experiences in that part of my world. And I'll pass it on to Elise.
Thank you. My name is Elise Higgins. I use they and she pronouns. And I am an abortion policy expert and organizer. So I work for a bunch of different organizations in the abortion sphere, including Planned Parenthood and the Kansas Abortion Fund. And right now I'm finishing my dissertation on abortion in the Kansas legislature, just really trying to see how many times I can say abortion in one sentence. And right now, I am also working for Kansans for Constitutional Freedom, which is the organization that helped us to keep our right to abortion back in August of 2022. I also wanted to say Pegah was my doula for the birth of my son. I'm so grateful to her for that. And Amber is a friend and a colleague, and I'm very grateful to Teresa for organizing this panel and facilitating it in such a thoughtful way. So thank you for having all of us.
Great. Yeah. Thanks so much to all of you for being here and sharing your time. I'll go ahead and read the first question. So, since the overturning of Roe v. Wade in 2022, abortion bans and restrictions have been put in place in several states. What impact has this had on the health, safety, and finances of individuals in this country, as evidenced through your research or firsthand experience in the field? And secondly, are there populations that bear greater risks or burdens as a result? So I guess let's go ahead and start with Elise.
Excellent. Well, so first to talk about the health, safety, and finances of it all. So just to kind of level set, abortion is banned in 14 states. It will probably eventually be banned in about half of the states in the country, depending on the outcome of different kinds of litigation. And since the end of Roe, we have watched mostly Black and Latina and Indigenous women be arrested for miscarriages. We've seen children forced to give birth, cancer patients denied care, and women stripped of reproductive organs. We have seen women die. I want to lift up Amber Nicole Thurman and Candy Miller, two Black women from Georgia who are dead because of that state's 6-week abortion ban. We now live in a country where hospitals routinely turn away miscarrying patients, and OBGYNs advise pregnant people to get insurance to cover hospital flights. That sounds not real, but it is. That's something that's happening in Idaho right now. In case they need emergency care, that would be illegal in their home state. And research tells us that now about 1 in 5 people who are, able to get an abortion have had to leave their state to get it. And about twice the amount that abortion funds and practical support organizations used to spend, twice the amount of people are traveling that used to travel before Roe fell. And about abortion funds are paying about 3 times as much as they used to because so many people need funding for travel and food, childcare, lodging, and of course the appointment itself. And then you had asked about more burdened populations. And I want to be really clear and specific about that because I think it's easy to say, well, yeah, people of color are more burdened, but specifically, not only are Black and Latino and Indigenous people and people living with low incomes and trans men and non-binary people and immigrants and young people and people with disabilities, they're all particularly likely to encounter compounding obstacles to abortion care and to be harmed as a result of that. So the stuff that contributes to that is income and health insurance disparities and healthcare provider bias. We know that there is a lot of anti-Black, anti-Indigenous racism, right, in healthcare providing institutions. But those are not really even about individual people usually. That's about big systems, right, and public infrastructure. And that results in people systematically being denied the ability to have an abortion, the ability to get birth control, and the ability to have kids and give birth safely when they want to. And I want to give one quick example of a policy choice that we're making in Kansas right now that kind of compounds that inequality, which is that Kansas has refused to expand Medicaid. Our state legislature won't do it. And among reproductive aged people, which is about 15 to 45-ish, among those folks who are women who identify or who are eligible for Medicaid, or would be if the state expanded Medicaid, 2/3 of those are women of color, right? So that's a specific racist and sexist policy choice that we're making. So I'll turn it over to Pegah.
Thanks so much, Elise, for all of that. I think I'm gonna talk about this from a personal base because my work with clients is very personal. You learn a lot about their joys, their fears, their hopes. It's like an exciting time in their lives. And it can also feel like a scary time in their lives. So if anyone has kids, if you can think back to all of that, I hold a lot of that with them. And one of, what's happened, and even though Kansas still has some, abortion rights, what I've seen that my clients have had to go through is if their pregnancy is not viable, they can't pursue a you know, medical care to help with that miscarriage until there's no heartbeat. And this can be, you don't know, you know, in a situation when it's not viable and there may be a miscarriage that is happening, you don't know when that heartbeat is going to stop. There is no formula for that. The doctors don't know. They can't say for sure. It could be a week, it could be a day, it could be later that day, it could be 2 weeks. So the risk that a person is put in by having to wait until that heartbeat stops, even though all of the medical providers have said that this pregnancy isn't viable, that can put people in some medical danger. And that, you know, I've had to be there for a client in that situation, and the not knowing what was going to happen, the scary of it, and also just the pain of now carrying an embryo that was going to, you know, not be the child she hoped it was going to be, and now having to prolong the mechanics of that miscarriage. You know, we have the medical ability to help people through that, and for the restrictions, it's hard, you know, it's a medical harm, it's a psychological harm. And, you know, I think as what Elise said, it's gonna disproportionately affect people of color and lower income, you know, that I get really scared every time when a client comes back and they're like, "Oh, let me tell you what the doctor said," you know, because I always hope that it's, you know, one of those, "Oh, that's not so bad." Okay, cool. There's a thing forward versus, you know, they think that I'm going to have, you know, there might be a stillbirth or there might be this or there might be that, but I can't. And that to me just feels like, oh my gosh, you know, we shouldn't have to be worried about that. People should have the medical care that they need when they need it with their providers and how they need it, that is safe for them. Um, so that on a personal level, when I'm working with my clients is scary, and dealing with that and helping them navigate that and talking with their providers it's real. And, you know, unfortunately, all of my clients, they don't have pregnancies that end up in live births when they start. It is a journey that can be really difficult for some folks. It's not the movies where someone gets pregnant, has a healthy baby, and you sort of move on with your life. For some, there's a lot going on there. So that to me, I think is a real impact that these laws are having on us, and even more so on places where there are full bans. So that's where I'll stop. Go, Amber, it's all you.
All right, well, I'm gonna play cleanup, and I love playing cleanup. I think what Elise did was really set the tone for the full scope of what we're dealing with. And oftentimes it is overwhelming. As speaking to individuals who are new in their advocacy, even many of us who have been in this work for quite some time, there is a sense of overwhelming. And so oftentimes when I'm talking to someone who is saying, you know, I want to be more involved, I want to be more active, I want to understand how I can be a better advocate, I tell them to take a step back, take a deep breath, and imagine reproductive health, which is all the things, it's the umbrella. Imagine that is the Milky Way. Okay. And we know what's all part of the Milky Way. Our solar system is part of the Milky Way. And abortion is one of the moons that orbits Saturn. So the thing is that reproductive health is so vast but yet what we are seeing disrupt our country is something so small, and it's being blown up and hyper, it's very hyperbolic in how it is pushed in media, um, and access to health, economic aspects, climate aspects, and I can talk more about that in one of the questions later. Um, but when you think about it in that way, that kind of helps to center people to say, I'm not asking you to travel the universe. The moon is right here, but we need to let folks know in this big thing, this is just one little thing. And this one little thing has disrupt the universe of reproductive health in our country to the point that we have women and children dying at faster rates than third world undeveloped countries. So in that sense, what we're seeing right now with so many ballot measures, with so many atrocious laws that are being passed on the state level, is that we are in a perpetual state of confusion. It is the literal illustration of moving the goalposts. No one at any time knows what's going on, and you have to be in tune to what's going on, not only in your state, in your region, across the country, as to what these laws are doing and how they impact one's ability to navigate. And we haven't even talked about the barriers of that and the intersectionalities of those. Elise touched on several of them, but we didn't even touch about intersectionality. We talked about socioeconomic. We talked about cultural ethnic. We talked about geographic. But intersect any of those, depending on where you are in the country, we're at a place where there is a very conservative movement to make abortion unthinkable and unnecessary. Not by my choice, but by someone else's choice. And so to know that what we're seeing, what's being done in our country is essentially an erasure of my ability to have reproductive freedom and autonomy over myself. And so to challenge that, that's what we're doing. We're challenging, and it's on it's a very triangulated fight where you had the Dobbs decision kick things back to the state, but yet you're seeing a federal presence in things. And now you're seeing the state say it's the will of the people. But depending on how the mechanisms for that, how that occurs in your state, it may not necessarily be the will of the people. The state of Kansas is not a ballot measure state. So you have states where you can petition for things to go on a ballot to be voted on by the people, or you can have a state like Kansas where we're at the mercy of a legislator and the legislature to actually make that happen, which oftentimes it wouldn't. So where we're at, and how do you hear all that and say, how do I stay positive? I always tell folks, the fight is a fight because someone knows you're winning. And so we're in this fight because we're still winning. And so that is the hope. That is the mustard seed of the pearl in all of this that we can look at and say, hey, we have to continue the fight because we are still winning. And even though sometimes the perception and the narrative is that we're not, we are. And so knowing what the end game is, which is to make abortion, this one little moon in this vast universe, unthinkable and unmeasurable, we can now know where we need to fight and how we fight. We do fight with reproductive rights. We do fight about the access to abortion, but we talk about the access to contraception. We talk about the access to care, the cost of it, Medicaid expansion, Medicaid paying for abortion. There are so many different aspects under the umbrella that, again, it's the part of it's like an iceberg. It's the part of the iceberg we don't see under the water because we see the abortion piece, not realizing that if we can continue to fight that, we know there's so much more up under the water that we have to continue to fight for that we just don't see. So that's what I'm seeing. It's a perpetual state of confusion that so, I don't say so many, that and not even a choice few. It's just individuals in our community, our brothers and sisters, fellow humans in our country that truly believe that this is something that should be unthinkable for them and unthinkable for you and unnecessary for them and unnecessary for me. And the flaw with that is that I didn't decide what shirt Pegah wore this morning. I didn't decide how Teresa wore her hair today. I didn't pick the cute glasses that Elise has on. Those were all their choices. And trust me, I have a hard time picking out glasses and earrings and my clothes each morning. Heaven forbid I have to try to do it for millions of people in this country. So what we need to do as advocates, and what I strive to do, is to take the overwhelming sense of how do we continue to move on? How do we get our hands on this and say, this is the one piece. There's somebody out there to do the other pieces. Once we build our coalition, we continue to strengthen our coalition, we're going to keep moving, but we are winning because we're fighting. So take the negative and flip it to the positive.
All right, so I'm going to move right into the next question. What have the unforeseen consequences been, if any? And I'll start with Pegah this time.
Say it one more time. I'm helping usher my kids out of the
All
house.
right. Yeah,
I'm
yeah,
sorry.
yeah. We can start elsewhere. If you,
No,
Okay.
just repeat it and I'll be ready.
all right. What have the unforeseen consequences of the restrictions and bans been, if any? Like we've talked about a lot of them. Which is very insightful. And I just wonder if there are any that y'all didn't predict as well.
I think what I didn't predict was that because of the uncertainty that hospitals and doctors are dealing with the laws, that I've had some clients that like couldn't even just get care until something worse happened during that pregnancy for them to get care. So they couldn't, the emergency room wouldn't do anything because it's this gray area that they don't really understand within the law. And they don't want to take that risk because of these laws. And then I actually had a client go in and they were like almost hemorrhaging at this point. And it was really, I mean, that's really scary to be like, you have to wait until it's so bad that the emergency room doctors can legally say that they're within the law to care for this person. And that, I think I intellectually knew that the bans would do something like that, but to be faced with it was a very different feeling. And I think this is when I think about what Amber was talking about with advocacy, I walk in with, when I take on clients, I very often do not and would not make the choices they make for their births. Very often would not make those choices. And so many times when they're telling me, what they want to do or their birth plan or what they decided with their doctor, there's oftentimes in the back of my head, I'm like, oh my gosh, why are you going to do that? But I don't do that. I don't say anything. I make sure they have the information they need. I make sure that they, did you get all your questions answered? Is there another way you need to answer them? I never steer them in a different direction. And so now to have laws that are making decisions for people in ways just feels so ludicrous to me, that there's just no agency in that, and the scariness that can come from having to wait until your health is so bad that the doctors feel legally okay to help you during that pregnancy. So I don't know, I never push my agenda on my clients, and, you know, I just don't understand pushing agendas on anyone's medical decisions or needs. So that to me, again, you know, intellectually, I think I knew it, but to face it was really different.
You know, I would say I want to start out what we knew were going to be foreseen consequences, because they set the tone for the unforeseen. It not that it sets the tone, it gives you a moment of pause and almost a feeling of just unease when you hear some of the unforeseen consequences that have occurred. But some of the foreseen consequences that we knew would occur is an increase in infant and maternal mortality. We knew that because we saw reductions in infant and maternal, and specifically in maternal mortality when Roe became the law of the land. And so to see something happen that we knew was a form of prevention for one, is truly disheartening. Hey, cutie. No, that's that's the biggest one, death. And if something is supposed to be done to prevent death that is taking life, they have to cancel each other out. And by canceling it out, that means you don't have abortion restrictions. So I start with that. What are some of the unforeseen consequences? I would say it's not a matter of when, it was a matter of what and how. Elise spoke to one in regards to emergency care. Um, that that we know, for some of us, we know as EMTALA. So EMTALA, which is a long acronym for essentially saying that hospitals that receive Medicaid and Medicare are required to provide care to individuals who are in emergent need. What you have seen in our country is, now that Dobbs kicked the decision back to states, states are now challenging, and now that some states have restrictive abortion laws on the books, you're seeing states now challenge federal law, which is counterintuitive because we know that states have autonomy, local government has autonomy with state law, state has autonomy with federal law, but federal laws do preempt certain state laws. And what you're seeing now is where maybe this was part of the long game, where you have those in the pro-life movement are now challenging certain federal laws to say that they preempt state law's ability to function. You've seen this with EMTALA. We're seeing it in Louisiana, where we're October 17th, so October 1st, where Louisiana made our Miffy drugs, so mifepristone, and misoprostol, which are two of the drugs used in medication abortion, have made them controlled substances. That it greatly impacts a physician's ability and duty of care and how to deliver care. And so what we're seeing is these state challenges to federal law, stating that federal law can't preempt state law. Another example is in Oklahoma, where Oklahoma has a 6-week ban. Any state that receives maternal health dollars, MCH dollars, through HRSA, through the federal government, there is a piece in there that they are supposed to provide information as it relates to all types of care. So an individual, whether it's a woman or person who is wanting to have access to all information they need to know about carrying a birth, carrying a pregnancy, that includes notice of information around abortion services as well. Many states try to tuck that language or try to do workarounds. In Kansas, we had the law that was passed in 1997 called the Woman's Right to Know, which is not what it is. So it's not what it says. It doesn't do what it says. You have to see what it does, which restricted language and one's ability in certain entities that were receiving dollars to even say anything about where abortion providers are. And so now what you're seeing is that under the current administration, there were several states that their their MCH dollars were taken away. Well, and it's their Title 10. So their Title 10 dollars were taken away. Well, they're actually fighting the federal government to say, well, we understand that these dollars are to be used also to notify women and persons about all aspects of care that they can get while pregnant. But on our books, we don't recognize abortion. So therefore, you can't take our dollars away if we don't choose to do this, because that's our choice. And Dobbs, you kicked it down to us, so that's our choice. Federal government saying, yeah, that's your choice. That's fine. But we're going to take the money away because these are our rules. And if you don't want to follow these rules, that doesn't necessarily mean we still give you the money. That just means you don't get it. So now you have states suing, saying, well, we want that money because we're still doing all the other things. We're just not doing that one thing. You just can't take all the money away from us. And so again, when we talk about that perpetual state of confusion and the moving of the goalposts, the unforeseen, another unforeseen consequence of this is that you have state entities that have, legislatures in states where they have restrictive abortion laws. Now you have state-funded entities. And I say state-funded because your state offices, whether it's your health and environment, your DCF, your Department of Labor, your Department of Commerce, those are ran by tax dollars, dollars that you and I pay. And while we may have a difference in ideology about things, these state dollars exist so for us to draw down federal dollars to fill the gaps in need. So if we're not doing that, we're creating greater needs. So again, it goes back to, if we're doing something that makes things worse, it's widening the gap and not closing the gap, maybe that means we shouldn't do it. And then that means we ask the question of, why are we doing it then? If it's not changing the behaviors, it's not changing outcomes. So the unforeseen to this is that at what measure, at how far states are going to challenge federal law to say, you can't preempt us anymore now that you've kicked Dobbs back to us. So it's created this weird legal tailspin that I did not stay at a Holiday Inn Express, nor do I plan on going back to law school to figure out.
Not a Holiday Inn Express. I mean, someone had to say it. So I agree completely with what Pegah and Amber said about some of the different unforeseen consequences. And I want to offer sort of an alternate perspective that just focuses on the maternal mortality piece of things. And I would say that in that specific case, every consequence of overturning Roe was foreseen. Anti-abortion politicians and lobbyists and judges, the people who engineered the overturning of Roe v. Wade, knew that women and trans men and non-binary people would die, and they did it anyway. And that sounds conspiratorial, but I want to offer some additional information for your consideration about that. So first, Republicans are appointing anti-abortion extremists to maternal mortality review committees, or are disbanding those boards altogether in states with abortion bans. Anti-abortion organizations are sowing distrust in credible maternal health data. Abortion is one of the safest medical procedures that there is, but Republicans are passing laws that artificially inflate abortion, quote unquote, complication rates, which is designed to make it seem like abortion is killing people rather than the laws prohibiting abortion. Something that's happening even right here in Kansas, there are organizations like the Charlotte Lozier Institute, which is based here, and they churn out junk science that then conservative lawmakers and judges cite and can use as proof that abortion bans are safe when they're not. And then something that I think we see everywhere now, and that I hope that folks are aware of and keep their heads on a swivel for, are that anti-abortion politicians are claiming that people who are for abortion rights have somehow frightened medical professionals and their lawyers into misreading laws. A feminist reporter that I follow named Jessica Valenti says, in other words, they set the world on fire and then want to blame the people pointing out that it's burning.
Okay, so I am gonna skip ahead a little bit to the last question, just because Elise kind of touched on this already, and so this way we can sort of expand on it. There is a lot of misinformation and disinformation out there about any given topic, but certainly about reproductive health and abortion access. How can individuals seeking information on these topics know that what they're reading and seeing is accurate? Are there places people can turn to for trusted information on reproductive health, no matter what decisions they make? So Amber, let's start with you. You're on mute.
Sorry, I was pulling up my notes. In the world that we're in, I say, where do you go? You always go to your trusted resources, and you go to those who are part of a network of that are closely associated with those who are doing the work. For here in the state of Kansas, we have 3 strong organizations that have kind of been in the center of reproductive health work or reproductive rights advocacy in our state, and that's the ACLU, Planned Parenthood of Greater Plains, which is a umbrella of PPFA, which is the National Planned Parenthood Organization, and then you also have URGE. And so these 3 entities, oh, for those who don't know what URGE stands for, sorry, because I know we're using acronym alphabets and we can't always assume everyone knows. URGE is Unite for Reproductive and Gender Equity. And so starting with those 3, those are your roots. And so there are others that fall from that, whether it is the Abortion Care Network, it's the Center for Reproductive Rights, it could be the National Latina Institute of Reproductive Justice, you have the National Black Women's Reproductive Justice Agenda, you have Sister Song, National Women's Law Center. I can continue to go on and on Reproductive Freedom for All. These are your stalwart organizations that are often we go to as resources. 6, State Information Exchange. These are all pieces that has connections to different, all of these entities that share information. And so in a world where things are crisscrossed all over the place and where folks are not fully understanding what they're hearing, what they're seeing to be the law, these are organizations that I lean to, that I've leaned on and have reached out to just to help me navigate spaces. Because again, in our communities and what we're seeing with these laws, individuals are traveling hours, days. So though I had the privilege of working for an organization that provided some of the most phenomenal abortion care in this state, it was no easy task. Oftentimes you have individuals who are on the call with folks for about 15 to 20 minutes, pulling everything they can to assess. So my thing is, so you may have someone calling you from New Mexico, Texas, Oklahoma, Florida, Illinois, Louisiana, Kentucky. And so they're coming with you with this information. And so oftentimes we have to lean on these partners to gravitate toward that, to figure that out and to grab that. So, for me, what I've shared with folks is that these are your stalwarts. This is who you go to. And as you build those relationships and you understand that's how you're getting information, then you have a trusted source on how to do that relational engagement with family and friends to push information out. Because we constantly are being bombarded. Places like Charlotte Lozier, whether it's other conservative entities, the Human Rights Coalition, a lot of these entities are starting to take on the faces of their in their case, their adversary. And so they're starting to look more like their websites, and their information is starting to look more like those of of pro-abortion, pro-repro health entities. And so knowing them by name, calling them out by name, helps you to stay focused, to be very technical and tunnel about where these organizations are, who they are, who are the players that are associated with them. And so that's, you know, we all have to experience it. You know, I know information comes to us very quickly, and if there's any advice I can give someone, is that it's not going to come to you in bite size. You have to be able to discern. You truly have to have, as my grandmother would say, a true spirit of discernment when it comes to recognizing information in this, as we talk about reproductive health and access to abortion, because like I said, the goal is to make abortion unthinkable and unnecessary. And we're seeing where folks are going to great lengths to distort any and every aspect of medicine, health care, and everything. So I can't, it's a constant work. This is not static. It's quite dynamic in how things evolve and how information evolve, and being on point with where and how you capture the right information and sources for education and enlightenment. So don't mean to drone on there, but it can be difficult at times. But several of those organizations that I shared, they are some of the best, and there are ones that I still call on for assistance and for any, just any negative advice or helping me discern different laws and policies in different states.
All right, thank you for that. Also, Elise, I think this went out to the attendees as well. Elise shared some information in the chat that I pasted into the chat for everybody to see as well. And Elise, if you want to go ahead and go next.
Absolutely. So what I just asked Teresa to share, thank you so much for doing that, are options if you are a person who is pregnant or has miscarried or wants to talk to somebody about pregnancy or abortion, or is worried that you might need legal support. All of the resources that I just put in the chat are reliable and staffed by professionals, right? And are really well vetted. And I wanted to also follow up on what Amber was saying about how there are a lot of places that share, information based on junk science, and it can be hard to find the truth. And I wanted to specifically talk about places that sort of advertise themselves as kind of being all options and being a place you can go if you're thinking about abortion, but which are actually anti-abortion. And these places are sometimes called crisis pregnancy centers. They're sometimes called anti-abortion centers. If you read about them in the news, that's what they'll be called. The Associated Press has changed to anti-abortion centers because that's what they are. But they are a mobile van or like an in-person, like physical location that tries to prevent people from accessing abortion care. They are misleading and unlicensed and unregulated, and of course, deeply biased. And unfortunately, in Kansas, they're also funded by the state, right? So even though we have this fundamental right to abortion here, the Kansas legislature still decides how we spend our money, and they've decided to spend some of our money on that. Here's a checklist that can help if you are somebody who needs an abortion or who's trying to help a friend get an abortion. And let's say you Google abortion in Kansas and some of these places come up. First, if you call them, ask if they provide abortions. If they don't, ask if they will refer you to an abortion provider. If the answer is no, and they won't give you a referral, they are not an abortion provider. They are an anti-abortion center. You can also check for phrases like pregnant, scared, or of course, pro-life. And you can also check to see if they're affiliated with national, religious organizations that put these fake clinics together, like Birthright International, CareNet, Heartbeat International, or National Institute of Family and Life Advocates. You can also look for clues in the name. So a lot of these places have similar names, and they include stuff like Pregnancy Options, Pregnancy Resource Center, or Pregnancy Care Center. And then the last thing that I recommend you do, if you have Googled abortion Kansas or abortion Lawrence or whatever you may have done, and you can't tell, like, is this place real or not? If you can find them on Google Maps or whatever other map you like to use, check to see what they're near, because these anti-abortion centers are often located very close to places that actually do provide abortion and birth control. And they may even use similar signage to try to confuse people. But if the place that you're looking up is less than a block away from a Planned Parenthood, you have not found an abortion provider, unfortunately. You have found an anti-abortion center. So I really recommend, again, the first thing to do would be to check if they provide abortions again. And if they don't and they won't refer, you have found a fake clinic, you have found an anti-abortion center, stay away.
I don't like Amber and Elise always blow me away with the knowledge that they hold. With the, I mean, I was taking notes, Elise, because I don't think I knew all of that. So I think that's really helpful. I don't have that information, but with misinformation, I do see it even in the birthing world. And I want to highlight again what I said earlier, that most of what my clients choose for their births would not be what I would choose for my births. And actually most often they were completely opposite of what I would have ever done. But I never tell them that. And I never gear them in any one direction or the other. And I do hear people within the birthing community not have a lot of information. So whether it's assuming that abortions can happen at 9 months, or assuming that it's used as a contraceptive method, there's stuff out there. So I think when you have a doula or someone who's kind of helping and guiding, I think it's always good to do your own research. And the things that Amber and Elise pointed out are really good ways to identify what is true, medically backed up information versus what people just think or say or hear. We're social human beings, and things get jumbled up along the telephone line. So I just think it's really important to be diligent and to be curious, really, and dig a little bit deeper. So that would be my I think that's what I would add. I don't have any specifics. I know that when a client comes to me with something, I'm doing a lot of research for them and figuring things out. But yeah, thank you, Amber and Elise, for the information nationally, but most importantly within our communities. That is going to be really helpful.
And Therese, if I can add real quick, one of the things I wanted to touch on that Elise painted a wonderful picture about is just, what are we seeing folks call themselves? And you're seeing that in a lot of these entities that that truly promote that they are an all-inclusive place for individuals who are pregnant, and that's not always the case. You're also seeing that in laws, and I know that was one of the questions, and I wanted to be able to kind of touch on this, is that even in policy, folks are starting to be creative with names and how they are titling things. We see pregnancy crisis, we say pregnancy crisis center. Now you're seeing pregnancy compassion, or born alive protection, and things of this nature. So these are all to kind of give it this flavor that it's doing good when it's actually these are policies that are nefarious in thought as well as on paper and in action. And so what you are seeing in legislatures, and again, you're seeing several states are often the breeding grounds or the practice grounds for a lot of these policies to say, if it can happen here, then we can kind of fine tune it and move it over here to this state and it'll catch like wildfire. You see this with a lot of LGBTQ plus legislation that intersects as well with reproductive rights and freedom policies, as well as with an emphasis on gender affirming care. And so just wanted to, those who are in attendance to share that sometimes it's not just called out as abortion. Elise talked about funding being siphoned off. You're seeing that as well, where dollars that are supposed to be used, that are used as matching dollars to draw down federal dollars, are then being used for something that that the intent was never there to begin with. We've seen that with TANF, temporary assistance for needy families, where those dollars are not going to needy families. They're going to a lot of these places, pregnancy crisis, pregnancy resource centers, to fund their operations because they're not financially able to sustain themselves. In the state of Kansas for the last 2 years, to the tune of $2 million, the state has done that. And there has yet, and I can look again, but I have yet to see a report on the expenditures of those dollars. You're seeing things in other states that may slowly bubble up, like we saw in Louisiana, where Medicaid, not only did we see the 5th District sue the federal government over mifepristone and sue the FDA to say to take it off. We're also seeing in Louisiana and in other states where they're trying to make these drugs controlled substances. We've seen challenge, like in Arizona, the Comstock Act, a law that people thought was long gone and dead, and that is being resurrected to be used in these cases. In Oklahoma, we saw it as, we're seeing criminalization and not just of providers, but of friends and family, and now even the actual birthing person. We're seeing from a climate justice standpoint, where you see states that are trying to enact laws to criminalize a person if they use they use medication, where they use mifepristone, Miffy or Meso, and then it's found in the water. So they're talking in the wastewater. They're trying to sue individuals. I mean, and all of these things are just, they're unfathomable, and it's a waste of taxpayer dollars. But again, this is where we can't, where I say don't be overwhelmed, but let's think the way they, where things that matter to us are now being used against us, where our healthcare matters to us and how we access it, it's being used against us, where our climate care, where we care about our climate, it's now being used against us in reproduction, and our economics and our economic justice and economic freedom, that's being used against us. And so sometimes we think when we see these laws, we're like, oh my goodness, what more can they do? We now have to think like they do. And you're seeing in the advocacy role, some of these things just don't surprise us anymore, because it's just like, wow, they just took the thing that we cared about and just flipped it on its end, and is now using it against us. So those are things we can see. You're going to start seeing, attacks on, you'll continue to see attacks on access to contraception, the age, the choice of how it can be delivered. You're going to continue to see attacks on, I think you'll see it from a controlled substance standpoint. We're seeing it as it relates to issues around medical and recreational marijuana. So again, the things that we care about, it's being flipped on us and now used against us, unfortunately.
Okay. So I think we've got around about 15 minutes left, and then we'll see if anybody from the audience has questions. So let's see if we can do one more. What can you tell us about abortion laws in Kansas, and what legislation, if any, should Kansans be on the lookout for? Elise, would you like?
I would, just because then I have to go get my son's stuffed duck, which is so important to have at night. So most important thing about abortion and laws in Kansas are that you have a fundamental right to have an abortion here because of our state Supreme Court, which has now ruled multiple times that we have that right, and that any restrictions to that right have a pretty high bar that they have to clear. That said, we do still have a pretty restricted environment when it comes to abortion here. And those restrictions are pretty impactful for most people, unless you are a wealthy adult with an uncomplicated pregnancy. So I'm going to tell you what's in effect right now. And you may have heard about other restrictions than the stuff that I'm going to share here. And if I don't share about those restrictions, it's because they're being blocked in court right now. So in Kansas, abortion is banned at 22 weeks and later, which particularly impacts people who have wanted pregnancies that have gone wrong later. State Medicaid coverage of abortion is banned except for in very limited circumstances. Private health insurance coverage of abortion is also banned, except in very limited circumstances. Parental consent is required for minors to get abortions, and only physicians can provide abortions, and not other other healthcare providers who are also qualified to do abortions cannot provide them in Kansas. That said, right, we do have things like the Kansas Abortion Fund, which can help people to afford abortions, which is good because, again, all of us are paying out of pocket for our abortions, right? That's what the law in Kansas requires us to do now. It hasn't always been that way, but since 2012, a lot of people need financial help affording their abortions. And again, that's what the Kansas Abortion Fund is for. So if you are somebody who needs an abortion and needs financial help with that, you can actually arrange for that help just when you schedule your appointment, right? You'll tell them that you need financial support, and then they will contact the Kansas Abortion Fund for you and work with them to get kind of a discount or a voucher basically applied to your care. And then things that Kansans should be on the lookout for. So Amber did a fabulous job of talking about medication abortion and how that's been like an issue at the United States Supreme Court. You've probably heard about that at some point over the last year if you're a big old abortion nerd and has been following that stuff. And unfortunately, that case is not yet over, even though the Supreme Court said basically, we're not going to do anything on this right now. And just yesterday, actually, our Attorney General in Kansas, Chris Kobach, along with the Attorney General of Missouri and Idaho, filed sort of a new brief with the Supreme Court saying, we think that we are going to intervene in this case, and here's what we want to happen. They want for medication abortion to no longer be available via telehealth. Which it is right now, and it helps a lot of people in rural areas get access to it. They don't want minors to be able to use medication abortion, which is not based in science at all. Like, it's equally safe for minors. And they want medication abortion to be used for a smaller part of pregnancy, even though it's safe to use up until 11 weeks into a person's pregnancy. So I would say keep your eye on the Supreme Court and medication abortion. And that's particularly important because medication abortion, both in Kansas and nationally, accounts for about 60%, that's 60% of abortions that happen. People like to be able to have an abortion at home if they want to, among their friends or their family or by themselves. And it's a really convenient way for some folks to kind of have more control over their healthcare than they might, having an abortion in a clinic, which is also totally safe and fine. But it's a really important option that a lot of people use, basically. And so keep an eye on that because our own state attorney general is trying to make it so that it's harder to access.
All right. Pegah, I wondered if you had anything to add to that, or even just, I mean, you've already kind of touched on the how the 22-week restrictions have impacted your work, but if you have anything to add there.
I not to the degree that I think Elise and Amber can provide to everybody and to us. So yeah, I'm learning a lot in this way myself.
No, and I concur on everything that Elise has shared. We're definitely going to see a lot more Supreme Court cases and enjoining where our Secretary of State will be a part of any case that restricts access. I imagine if it's not filed within his office, which it would hardly be because of the funding mechanism, or I could see him taking that on, it would probably be from an enjoining with another state. So, that I don't think that's going to stop. Three areas that I would say from a state level perspective to look for in the next legislative session, which will be a new biennium. So this will be, you'll have new folks. So there may be one, we're going to see new people in the legislature, in the state legislature. That's a guarantee. Two, there will be committees. There may be committee changes. You may see changes in committee leadership. You may see changes in the number of individuals in committee. We do know that the majority party always has the majority of members in a committee, and so you may see ratios of 3-to-1, 4-to-1, depending on where folks are, where their subject matter expertise, or at least content matter expertise, would place them. And so where we've gone from mostly seeing abortion type law bills introduced in maybe Fed and state, health and human services, public health and welfare. We saw as of the last 2 years, prior to 2022 and actually after the August amendment referendum, that we're seeing abortion, pro-life bills introduced in taxation. You're seeing them, and there was one that was I think it was there was an attempt to introduce it in local government. So you're going to see there's going to be nuances in where bills are going to be introduced. And I think where you're going to see kind of a pattern that's picking up will be around fetal personhood. There are several bills that got traction with that. And there were ways that some legislators were trying to sneak it in to create precedents with that language. There are some statutes that have fetal personhood in the language, but it has never been defined in practice and policy. And so now you're seeing Republicans use that as a backdoor way to introduce fetal personhood. And I believe that that's being done in a way to look at things like Alexa's law, where a person can be charged, which Alexa's law in Kansas has, where an individual can be charged for the death of a fetus. So if a pregnant woman is murdered or injured in an accident, or if there's death of the fetus, a person can be charged for the death of that fetus, to again flip that and use that against the pregnant person themselves. Trap laws. These are often regulatory laws that are used against providers. We've seen those in several different entities in Kansas in the legislature, one being our healthcare stabilization fund, which is a fund that medical providers all pay into. That in the event that a provider has gap coverage in their insurance, they can go to the stabilization fund and draw down dollars in order to fill that gap. There's been several attempts to restrict abortion facilities that perform abortions from being a part of that. Those providers saying that is state dollars. Dollars that are part of the healthcare stabilization fund are not state dollars. There are no state dollars used to administer and oversee that fund. But I imagine that there will still continue to be ways to chip away and chip around that. And then lastly, I would say look at funding. Like I said, the last 2 years, there's been a $2 million proviso that we call, that is put in during omnibus. So when the legislature goes on a 3-week break, so they're only in session for 90 days, yet they find 3 weeks in between that 90 days to take a break. And so when they come back from that break, that's the veto session. And oftentimes the final budget bill is worked through, and it goes through 7 rounds of iterations of what the House and what the Senate decides on, what they want to be in the big budget bill that the governor gives them at the beginning of the legislature. In the last 2 years, there's been a proviso under Treasury for a lot of these, I say knockoffs, or you can say lookalikes or wannabes of pregnancy resource facilities to again provide them with funding, sustainable dollars to exist. And so, what this past year, while we've seen laws that were introduced in taxation to allow for tax credits and tax incentives to individuals who donate to these entities, I do believe you're going to see a more concerted effort to kind of continue to tap into dollars specifically to programs that draw down federal dollars that do things that touch the ecosystem of reproductive health. We talked about contraception, so that could be Title X dollars, that could be MCH dollars, which are housed in the Department of Health and Environment. We know that they've taken them from TANF dollars, which is in DCF. So where are other entities that you may see the GOP pull those dollars, attempt to pull dollars down to cycle them off into to help to add additional funding opportunities to these pregnancy crisis centers. So I would say we'll probably continue to see bills of those iterations in the state. And again, if there's a will, then our Secretary of State will see a way to be a part of anything related to SCOTUS, because that just highlights him, unfortunately, but it doesn't really do anything to elevate the needs and change the outcomes of the health of the people of Kansas, unfortunately. So it's wasteful it's wasteful dollars spent of taxpayers, unfortunately.
Okay, yes, I have also learned a lot in this session, so thank you. And I do want to open it up now to see if any of the audience has questions. You should be able to type it into the Q&A at the bottom of your screen. I haven't seen any so far, so if not, I have one more that wasn't on my list. Just keeping the panelists on their toes. Okay, well, I'll just ask it, I guess. For those of you with either like firsthand experience in clinics that provide abortions, or even Pegah with your experience as a birthing doula, what would you say is, what is the morale of staff and people working in that field? And, I think about, like, if, we've talked a lot about people in need of these services, but, there's the other side, of course. And I think about people who went into a profession not ever imagining that Roe v. Wade would be overturned, and not thinking that they might be in the position that they are, and kind of like the crosshairs of this political battle. And so can you talk at all about the morale? And I guess I'll start with Pegah.
I mean, I think there's the uncertainty of things at times. But, I just really respect the advocacy of people like Elise and Amber. There's an energy to that. And there's it's not even a righteousness, which is what I love. It's a very humble, we really want people to have the right information, and that they can get access to whatever they need when they need it. So that, to me, I just see that commitment, and that I think has been really great. It makes me hopeful because I feel like I can get the information that I need to get, and there are plenty of places that will provide it, and I can get that to my clients. So, it's not where I feel like I have to, backdoor channel things. I can still ask those questions, and I feel really hopeful that the folks out there who are advocating for us to have rights to what we need um, are just being really diligent. So that would be, I would say that's the morale for me and what I've seen.
Thanks so much for sharing that, Amber. Do you want to respond?
I was gonna say, that's not me with the train, but I wish I was by one. Um, you know, I, I would always tell someone that I met, have you ever been to an abortion clinic? And if they hadn't, I would say, do you want to come visit Trust Women? And there are several elected officials in this state. There are several congressional um, individuals from our state or from other states that I've had the pleasure of having them tour Trust Women. And the first thing I hear when they enter the doors is, it's beautiful in here. It's light. It's fun. It's engaging, and then they feel bad for saying things like, is it okay to say it's fun? I'm like, it's an office. Now we do things a little bit different as it relates to the clinic part of it and the what is considered to be the ambulatory surgical side of it, and that's the regulatory piece of it. But at Trust Women, when you walk into the clinic, this is an environment of, we want you to feel safe. We want you to feel secure. We want you to feel supported. We want you to feel loved, and we want you to feel at ease. I had the opportunity to work with 18 of this country's most phenomenal fetal maternal medicine OBGYNs. These are OBGYNs that our specialty is in high-risk pregnancies. They're some of the most brilliant minds out there that are nationally known, who come from Kansas, Illinois, Florida, Texas, Oklahoma, California, Florida, everywhere. And these individuals travel thousands and hundreds of miles, zipping across the United States to provide women and birthing persons access to something that they should not have to risk life and limb over. And so we know that those decisions they're heavy decisions to begin with. But when you add a geographical component to it, an economic component to it, a health and mental and physical component to it, the one thing we don't want contribute to us is for someone to not to add to the person's experience negatively. And so it's encouraging. We have a wall where patients leave notes, words of encouragement. We provide all the snacks that you want. Some of the best massaging chairs you'll ever have. We dream about healthcare not the way that it should be based on the people who are coming, because we don't know who's coming. And one does not get better preferential care over the other. So we want an experience. We want to create an atmosphere, again, that says you are here to make a decision. We support you in that decision. We're here to hear you out if that's what you want us to do. But we're going to provide you with the utmost care, and we're going to ensure as much as possible that you are on the mend with little to no hiccup or any type of adverse reaction. We educate, we inform. It's just I tell people just to have that experience, to know it. There's one thing to talk about an abortion in an abortion clinic. It's one to experience it, even if you're not having a procedure yourself, but to go through the process from the checking in to the ultrasound to where this to knowing how long. Most people don't even know how long an abortion procedure is, which for you to, if you want to know, less than 10 minutes. So we have all of these thoughts in our mind about what we think it is, but once you actually find out and you see it for yourself, this is about providing top-notch care for everyone. There is no big I's and little U's when it comes to abortion care. So I think it's a challenge to our healthcare system to provide radical hospitality to all your patients, no matter what, and to provide radical information about what is theirs, what is to be in true freedom, to be liberated from restriction, what that looks like, how to dream about that, and how to make that actionable through word, through action, through strategizing, through mobilizing and organizing individuals together to say, this is my choice. This is my story. And so I leave, there's an organization here in Kansas. I want to leave us with this thought that says that this is their motto is educating Kansans to say yes to life. And I would say I argue the same thing every day in the work I do. I am educating Kansans and Oklahomans and Missourians to say yes to life, my life, how I want to tell my story. And again, I don't wake up any morning trying to decide which part Pegah's going to put, which side Pegah's going to part her hair, or, you know, what color lip stain Elise is going to use. That I don't have time for that. That's not my journey. My journey is to decide for me. And so if we can do that, and if I can do that, then I know I'm doing the good work. So, that's what we want to do, to create radical hospitality, that's what we should be looking towards. That's the true measure of outcomes, not fighting each other about what I think you should be doing based on what I believe. Because fundamentally, we don't do that now. So why are we trying to do it with this?
All right. Thank you so much for that. Elise, do you want to respond as well?
I did, but honestly, what I have to say is kind of depressing, so we should leave it on Amber's note. I like I like what Amber had to say, and I appreciate you very much. And honestly, I would let you choose a lip stain for me because you got taste, and that's all there is to it. But I will say, to any of the participants, or any of the folks in the audience tonight, including my dad, if you have any questions, let me know.
Yes. Yeah. Thank you. I do agree. It's nice to end on that positive note. So thank you. And thank you for all of the audience members for being here today. Thank you so much to our panelists. I really appreciate you taking your time to help our community and myself, everyone involved, be better informed. So again, this will be uploaded to the library's YouTube page within a couple of days. So be sure to share with others. So thank you so much, everybody, and have a good night.
Thank you. Bye, y'all.